Hello, everyone. My name is Vivek, and I've been working in the healthcare industry for close to 15 years now. I'm currently working as a senior business system analyst, and I have been with my current organization for close to 8 years. Overall, my entire experience is in healthcare, and I have been working in the IT industry for the same amount of time. Today, I'm going to present the paper um, ethical implications of AI in patient care decisions. This study basically focus on the ethical considerations on using the artificial intelligence to make or assist in patient care. To begin with the presentation, I will have the introduction. So basically, this presentation examines the ethical implications of artificial intelligence in patient care decisions, like I just stated before, and that's how the topic of the presentation is. Um, Slow and steady AI technologies are becoming increasingly integrated into clinical settings, and understanding the ethical considerations is very crucial. um, this study basically explores how AI is transforming healthcare delivery while raising important ethical questions that need careful consideration to ensure patient welfare remains the forefront of technological advancement. This overall research basically explored the complex ethical considerations surrounding artificial intelligence integration in healthcare decision making process. And in this process, I have created 10 comprehensive slides, which basically captures the essence of the research that I have done and published this paper. Um, Now, for the first slide, basically, the presentation is explaining the it examines the ethical implications of artificial intelligence in patient care decisions. Um, in the clinical settings, and understanding the ethical consideration is crucial. um, and this is going to be the forefront of technological advancement in patient care in the given future. Moving to the next slide, AI applications in healthcare. So basically, in this, we are going to talk about the artificial intelligence, which has diverse application in healthcare setting. Um, Here are various several key implementations that we highlight, which is including the diagnostic algorithms and medical imaging such as X-rays, MRI, CT scans with remarkable precisions. So AI generally help in articulating or emphasizing more on what we see in the medical imaging, like the X-rays or the MRIs. um, with those, we do the predictive analytics that help us forecast the disease, the progression, and the patient outcomes. The recommendation system basically utilizes the patient data, including the patient's medical history, generic information, the treatment response, and how to generate personalized treatment plans for the patient based on their overall medical history. These AI applications aim to reduce diagnostic errors. They are helping in reducing the errors. Um, they are changing the approach that we are taking in personalizing the treatment, and ultimately, they help in improving the healthcare delivery and patient outcome overall. All right, moving to the next is the slide number 3, where we're going to talk about the ethical considerations overview. This piece of the research basically identifies several key ethical principles which are affected by AI integration in healthcare. Basically, it basically requires that the AI technologies pursue good on behalf of the patient. So, whatever decisions the AI is taking, the underlying assumption is that it is going to be good for the patient, but it does not emphasize mainly on minimizing the harm associated with the AI based interventions. So, patient autonomy is particularly important because it recognizes individual rights to self control and decision making regarding AI in their care. The basic justice involves ensuring equitable distribution of AI benefits across different population, and the transparency is how AI system makes decision in foundation, which is foundational to the addressing of these ethical considerations. Overall, these principles form an essential framework for healthcare practitioners and policymakers for navigating the complex ethical landscape of AI in patient care overall. Moving to the next slide, which is algorithmic bias and fairness. So the fourth slide basically is a major significant ethical concern, which is the biasness. AI systems are trained on historical healthcare data, which might be applicable to the current patient or not, but it also often contains existing biases and disparities based on the data, and it could be based on the race, it could be based on the demographics, it could be based on the gender, it could be based on the patient's age. So there are many factors, and this can lead to AI system uh, that the system is using to even amplify the biasness, potentially resulting in different approaches to diagnosis and treatment based on factors like I stated, such as race, gender, or maybe socioeconomic status. This opacity of many algorithms, often referred as black box systems, which makes bias identification particularly challenging. So we never know, whenever algorithms or the AI algorithms are making their decision, what kind of parameters they are referencing, what kind of what overall black box systems they are referencing, which makes this process opaque overall. So addressing algorithm biasness requires, proactive approaches to detect biasness during algorithm development and implementation, and specifically the learning system of the AI, because we know the more we feed the data into the system, the better it behaves, but it also makes those decisions opaque, which is coupled with continuous monitoring and evaluation to ensure the medical justice and equitable healthcare delivery is provided to the patient. Moving to the next slide, patient autonomy and informed consent. So, patient autonomy is the foundational in the ethical healthcare delivery. Patients should always know what's going on when it comes to their treatment and any kind of decision that is being taken on their behalf. So, the research emphasizes that patients should have complete comprehensive comprehension of AI technology involved. They should be made aware of how the AI will be included in the decision making process in their treatment, after their treatment, or probably in the patient care throughout. The AI technology involved in the care and treatment options, how they are going to be used to make informed decisions and choices. However, the complexity of AI systems are preserving patient autonomy, and additionally, the integration of AI may fundamentally alter the doctor patient relationship, which raises a question about patients' right to opt out of AI driven care, and how healthcare providers can effectively communicate complex technological concepts to ensure patient autonomy is respected. And this piece, even though it sounds very light, but it is very crucial. Patient should be the driving factor for whatever decisions they think the AI can take on their behalf. So we need to have a complete comprehension of how the AI technology is going to be used in their overall care. Now, moving to the next slide, which is accountability and liability. Um, so, l- because we talked about the the moving, we basically talked about the autonomy. So somebody has to be held liable, and for that, the accountability piece comes into the picture. So the question of accountability and liability emerges as one of the most contentious issues in AI-driven healthcare. When AI system makes error or produce adverse outcomes, determining who bears these responsibility. Is it going to be healthcare providers or AI developers or regulatory bodies becomes complex. So this complexity increases with more autonomous AI systems that operate with limited human oversight. The paper overall, the research basically emphasizes the need of comprehensive governance framework that clearly delineates responsibilities among stakeholders, and such framework must be balanced, encouraging technological innovation, which ensures patient safety and providing appropriate remedies when AI technologies cause harm, which overall establishes clear lines of accountability, which is essential for maintaining trust in AI augmented healthcare systems. Next is transparency and explainability, which is again, we touched based on the black box, because how the AI is going to use and how they are going to make decisions sometimes may become opaque based on the historical data, based on the new researches that are going on, and the AI has access to. So transparency and explainability are critical ethical considerations for AI in healthcare. Many advanced AI algorithm functions and as black boxes, which is making decisions through complex processes that are difficult for human to interpret. And the lack of transparency can undermine efforts to identify biasness, um, establishing accountability, and build trust in AI-driven care. Healthcare provider needs to understand how AI system arrive at their recommendation to appropriately evaluate and provide context, overall context to their research and their decisions, uh, which within their clinical judgment. So similarly, patients have the right to each and every explanations of how AI influences their care decisions. And these research, basically the research which I am presenting today, overall highlights the tension between developing increasingly sophisticated algorithms and ensuring sufficient transparency to maintain ethical standards and trust in healthcare delivery. Moving to the next slide. um, Data privacy and security, which is the outmost requirement these days, based on the kind of data that gets generated. And healthcare is always on top of the pyramid when it comes to the data, because it is said that in the future, the healthcare or the data pertaining to health of people is going to be the foremost important for a country to make sure that the next generation is always and always taken care of. So AI system in healthcare rely massively on volume of patient data, including medical records, their medical imaging, their lab results, and their genetic information, which raises significant concern about data privacy, security, and patient confidentiality. Um, and its storage and sharing of electronic information creates security or cyber attack issues and unauthorized access, which can potentially compromise patient safety and trust in healthcare system. So overall, implementing robust data governance and security measures is utmost essential to mitigate these risks. And healthcare organizations face the challenges of balancing adequate data access needed to develop and improve AI systems, along with stringent protection of patients' privacy. Ethical AI implementation requires thoughtful approaches to data management that prioritizes patients' confidentiality while enabling beneficial technological advancements. Um, the next slide, which is equity and access. Um, so, overall, there are concerns about equity and access in AI driven healthcare. There is a significant risk that advanced AI technologies could widen with the existing healthcare disparities rather than reduce them. Unequal access to AI driven healthcare technologies may leave the population further behind, particularly those affected by the digital divide or socioeconomic limitations. And the economic aspect of AI implementation currently includes high cost associated with development, deployment, and maintenance, which ultimately may influence which healthcare system can adopt these technologies, potentially creating a two-tier healthcare system. Example, healthcare system in rural areas versus the versus in the urban areas, and which basically requires justice in healthcare, requiring ensuring that the benefits of AI are equitable and equally distributed across different populations, and that technological advancements don't exaggerate existing healthcare inequalities. And the next and the last slide, which basically highlights the conclusion of my research on this paper. Um, so overall, while AI offers transformative potential for improved healthcare delivery and patient outcome, the ethical consideration must guide its implementation, and it's very important. I would like to emphasize that ethical considerations should be the driving factor of AI implementation, specifically in healthcare implementations. Um, so overall, this research emphasizes the importance of multidisciplinary collaborative collaboration among healthcare professionals, technologists, policymakers, and patients to develop comprehensive ethical framework, and an ongoing dialogue between all stakeholders, like I stated, but whether it's the healthcare professionals, ethicists, technologists, or the driving factor, patients overall, are needed to formulate these ethical considerations, which is essential to navigate the complex ethical landscape for AI in healthcare. Future directions include developing more ethical guidelines for various AI applications, which could vary from one for one population versus another, but it should be a guideline which is applicable based on conducting empirical research on AI's impact on healthcare outcomes or patient provider relationship, or creating dynamic policy framework which can adapt to rapidly evolving technologies. And it can prioritize ethical principles and patients welfare, taking care of AI development and deployment in healthcare settings, which can harness the benefit of these technologies with mitigating potential harms. Um, that's all I had for this presentation. Thank you.